నమస్తే, వెల్కమ్ టు TeluguOne Health. నేను గోపికృష్ణ. ఇవాళ మనతో ఒక ప్రత్యేక అతిథి, చాలా ఇంపార్టెంట్ అతిథి. ముఖ్యంగా చెప్పుకోవాలంటే ప్రస్తుతం ఉన్నటువంటి ప్రపంచం ఎదుర్కొంటున్నటువంటి ఆరోగ్య పరిస్థితుల నేపథ్యంలో మనం హైదరాబాద్ నుంచి TeluguOne నుంచి ఈరోజు ఒక ముఖ్య అతిథిని పరిచయం చేయాలనుకుంటున్నాం. ఆయన ఎవరో కాదు, ఈ మధ్య కాలంలో అతి ఎక్కువగా వినిపిస్తున్నటువంటి AEG హాస్పిటల్. ప్రత్యేకంగా చెప్పనవసరం లేదు దీని గురించి. సో హాస్పిటల్ డైరెక్టర్ డాక్టర్ జీవి రావు గారు మనతో పాటు ఉన్నారు. వారిని ఆహ్వానిద్దాం. సార్ నమస్తే అండ్ వెల్కమ్.
నమస్కారం గోపి. At the most, at the outset, let me thank A1 for this opportunity. Actually, నేను చాలా రోజులు చూస్తున్నాను టు గెట్ అన్ ఆపర్చునిటీ టు టాక్ టు ద వ్యూవర్స్ ఆన్ A1. బట్ థ్యాంక్ యూ సో మచ్ గోపి, అండ్ థ్యాంక్ యూ యువర్ ఎంటైర్ టీమ్ ఫర్ giving us this opportunity to be on A1.
వెల్కమ్ సార్. ఫస్ట్ ఆఫ్ ఆల్ నేను AEG గురించి ఒక సాధారణ ప్రశ్న అడగాలనుకుంటున్నా. AEG ఈ మధ్య కాలంలో బహుశా హైదరాబాద్కి పరిచయం ఉన్నటువంటి వ్యక్తుల్లో చాలామంది AEG గురించి ఈ మధ్య కాలంలో అతి ఎక్కువగా వింటూ ఉన్నారు. ఎందుకు సార్?
ఇట్స్ అ వెరీ గుడ్ క్వశ్చన్. యాక్చువల్లీ మేము AEG హాస్పిటల్ స్టార్ట్ చేసినప్పుడు ఇట్ వాజ్ ప్యూర్లీ ఎ గ్యాస్ట్రోఎంటరాలజీ రిలేటెడ్ హాస్పిటల్.
ఎస్.
So we had a 300 beds gastroenterology hospital, purely catering to gastroenterology, both medical and surgical. But we shifted from that, and we had a big hospital here which was constructed, and it is a state-of-the-art hospital which has got the best of the best technology, the infrastructure and the personnel here.
Oh.
So from a single specialty hospital we changed to a multi-speciality hospital. When we started this hospital, we had these apprehensions. Actually, we are building such a huge hospital, a 1,000-bedded hospital. From a single speciality hospital, we are changing to a multi-speciality hospital, whether it's going to be a viable thing or not. We initially thought it would take almost about 5 to 6 years for us to settle down.
Oh.
But surprisingly, the whole concept changed basically because of the way that we were trying to take this healthcare to the people. Basically, the entire healthcare concept at AEG right from the beginning has been to give it at an affordable cost. Nobody should be denied for the thing. We should have access to the latest of the latest technology and should be dealt and delivered by very trained, experienced personnel.
Okay.
And obviously supported by a lot of research that happens within the hospital.
Oh.
ఈ కాన్సెప్ట్ తీసుకొని when we started going about the thing, actually COVID, I can say it's a blessing in disguise for us. Actually, I mean, whether it's a positive thing or a negative thing, what happened was actually మేము COVID patients కి డీల్ చేసినప్పుడు we require all the specialities to come in.
Yes.
It cannot be single speciality.
Complete organs అన్నీ.
It deals with every single specialty that we have.
Yeah.
Cardiology, pulmonology, neurology, intensive care, surgery, gastroenterology, everything, psychiatry, diet, every single specialty that you talk about are involved in this. So the moment the COVID started, we as a whole, actually under the guidance of Dr. Nageshwar Reddy Chairman Garu, we decided that we should have a standard protocol, evidence protocol. It is not that patient is another question, I item వచ్చిన ట్రీట్ చేస్తామని. There has to be some evidence-based treatment and it has to be followed by everyone so that we get good results.
Okay.
Fortunately, the team was so excellent. All the people who joined us were so excellent. And we had this reviews every week, updating ourselves to see what is happening across the globe. మా దగ్గర basic science lab లో they were also doing lot of research to see why this is happening in India, our part of the world.
Oh.
And the solutions that came up were really, really interesting, that helped in translating this into patient care. And that helped us to be an edge over the others to deal with these patients who came to us. And we made sure that the costs were absolutely within the reach of the people. The care given was the best of the care given by the best of the people, and
Okay.
We had dedicated teams.
Actually, service మాత్రమే కాకుండా రీసెర్చ్ కూడా ఉంది.
Yes. The best part is actually, if you've seen last 2 years of COVID, actually we have almost about 15 papers that came from our own lab. Basic research lab, to see ఎందుకు కొంతమందికి ఎక్కువ సోకుతుంది, what are the different types of vaccines that can be used, booster dose ante emi ivala, basic COVID మన ప్రదేశంలో ఎందుకు తక్కువ వస్తుంది. There are a lot of areas which are involved in this actually. అంటే కొంతమందికి అంటే డిఫరెంట్ పీపుల్కి ఎలా ట్రీట్ చేయాలా అనేది లాట్ ఆఫ్ పేపర్, ఆల్మోస్ట్ అబౌట్ క్లోజ్ టు 15 papers came from which are published in very high impact journals. And so actually I'll be proud to say that we joined that bandwagon of that cream of people who made impact on COVID decisions across the globe. So our papers were also started
across the global.
Yes.
Yeah. Fine.
Our papers also started getting quoted in the international this thing, and obviously some of these things came into the guidelines of the thing. So fortunately, we are also thankful to the government of India, government of Telangana, who were very supportive to us, and then suggestions were taken and then translated very.
So మీరు రీసెర్చ్ లో సక్సెస్ దిశగా వెళ్ళారు అని అనుకుంటున్నారా? కంప్లీట్ సక్సెస్ దిశగా?
Yes, COVID. We have a very good team of scientists, almost about 20 scientists who are working with us. And actually, initially our research was totally toward gastrointestinal diseases and all actually. But COVID time, the attention's focused because this is most important, because if you see most of the literature, whatever evidence is coming is from the West.
Okay.
Or some developed countries. There is nothing major that is coming from our part of the country. And there is lot of evidence to show that the eastern patients don't behave similar to the western patient. And you take any other disease, you know that actually, I mean, we all keep saying that, okay, we follow the western literature, this same thing we follow. I mean, it's not, see, times have changed actually. Our patients behave differently, are genetically different,
Okay.
immunologically different. Their resistance power, maybe you can call that, is totally different.
నాకు తెలిసి ఇది ఒక కొత్త అధ్యయనం సీరియస్ గా.
Actually, this is known.
బయట దేశాల్లో ఎలాంటి లక్షణాలు ఉన్నాయో అలాంటివి వాడడానికి ప్రయత్నించారు చాలా మంది.
I think it's a right thing. Suppose if you see under disease pattern, simple example చెప్తాను, colorectal cancers తీసుకోండి ఇప్పుడు. The colorectal cancers in the West is totally different from our place.
Yeah.
So though the principles of surgery, principles of management are the same, but obviously our patients react differently. Suppose, okay, simple thing I'll tell you. Suppose a drug is tried in the Western world. Their genetic, this thing is totally different from our this thing. So obviously as in today we are just following what is followed in the West. But we should have our own data. Whether my this thing actually, simple example actually, whether if I give paracetamol tablet, whether I respond to 500 milligrams of paracetamol or 600 milligrams of paracetamol. See, there's a lot of difference which varies from person to person, and obviously now India is surging. Now we have seen lot of publications coming from our own country, showing how people respond, our people respond to these things. So that is very, very important actually. Initially it was purely we were following the Western data, but now we have our own data to say that actually, ఇది మన దాంట్లో చేస్తే they deal better.